Independent and impartial, I am Makwetla. The International Council of Nurses' new board of directors has issued a statement on COVID-19 vaccinations. They are highlighting nurses' a professional responsibility to be vaccinated, the continuing and lamentable inequality of access to vaccines, and of course, the need for nurses themselves to be protected from harm. In the new vaccine statement, ICN affirms its belief in the safety and efficacy of COVID-19 vaccines and its conviction that nurses have a fundamental role in enhancing public trust in vaccines and encouraging people to have them. It says nurses have a professional responsibility to follow public health measures, including getting vaccinated to protect themselves, the public they serve, and health systems they work in. The statement also urges governments to do more to ensure vaccine equity around the globe, particularly for vulnerable people and nurses and others who care for them, and calls for better protection of nurses against the abuse and violence that they have suffered while conducting their health education and vaccine administration roles. To talk more about the statement and the sentiments in it, we're joined now by International Council of Nurses President Dr. Pamela Cipriano. A very good evening to you, Dr. Cipriano. Thank you so much for joining us. I want to start with this statement about the fact that nurses' a professional responsibility to be vaccinated. And given the current context, which we've seen in various countries, the obligatory mandating of vaccination hasn't necessarily gone down well in all sectors of society. And I wonder if there have been such incidents within the nursing profession, or are the numbers negligible of those who object to mandatory vaccination?
I think whenever anything is mandatory, there will always be some individuals that have a personal choice that is at odds with that. But I believe, as you're suggesting, the number of nurses who have resisted vaccination is very small. Nurses are a trusted voice. They understand the science behind vaccination. They also understand that vaccination is the greatest way we will be able to stop this pandemic. And that is why ICN has been very clear in stating we believe this is a professional responsibility.
And you also say in your statement that you want to highlight the importance of nurses enhancing public trust in vaccines and encouraging people to have them. You talk about the violence that they've shared in this work. If we can just talk about it and how widespread is it?
One of the most damaging activities that has occurred throughout the pandemic is the spread of misinformation and scaring people away from vaccination with stories that have been made up. And that's really where nurses have a significant role to play, to provide accurate information. Again, knowing they are voted the most honest and ethical profession. They are widely trusted by our communities and all of the people that we serve. So that's been the really positive part of the role that nurses play. On the other hand, because there are skeptics, because there are individuals who are resisting vaccination for a variety of reasons, some of them have decided to take out their concerns or anger against nurses and other personnel who are in fact trying to keep them safe by administering vaccination. So in addition to just the vaccination aspect of where we've seen violence, it has also occurred in our hospitals and places where people are seeking care, because there is again mistrust of the whole health system in many of our countries. And so nurses being on the front lines are receiving some of that anger and frustration on the part of individuals. And I believe it's everywhere. There's almost no country that has been immune to hearing about the violent attacks against nurses, whether it's minor activities of harassment or whether it is assaults and very serious injury to nurses and threatening them. Some have received death threats. So it's a very sad commentary on the fact that misinformation has really fueled some negative reactions on the part of the public. Our role is really to continue to reinforce how essential the nurse is in making sure that we are spreading good information, encouraging people to get vaccinated, get boosted, follow all of the precautions of wearing a mask, not going into places with others if you're having symptoms, and being sure that it's clear that nurses are part of the force that want to keep us safe and be able to help us stem the terrible effects of this pandemic.
Dr. Cipriano, are you able to share with us the countries that had a significant number where nurses came under attack, who experienced bodily harm or threats to their persons, and if you were able to intervene on their behalf? And I'm looking at countries like, obviously there's been a great deal of change now in Tanzania, for instance, where there was a ban against speaking openly about COVID-19, the symptoms and the pharmaceutical interventions that were available. In South Africa, at the start of training for vaccines in themselves, there were nurses who were alleging that not only did they not have the information around how COVID-19 presents even after being vaccinated, but the negative after effects.
Unfortunately, I don't have specific country level information, but I can assure you that we have heard from many, many of our member organizations from around the world. And the stories are the same, that nurses have felt threatened. There have been situations where they have been run out of communities, where they have suffered physical violence. And really, any single incident of violence against a nurse, we believe, is unwarranted. And so our position really has been to communicate with the leaders of our associations in support of them, to their health ministers, to the other elected leaders within their countries, to say there should be no tolerance for these kinds of activities. There should be prosecution of individuals who in any way threaten a nurse or other healthcare provider or anyone who is providing vaccination or other care, not just during this pandemic, but any time. And so while I can't tell you specifically where it has escalated, it is a serious concern, because as you know, our healthcare workforce has been under incredible stress, and they have sacrificed for more than 2 years to be able to fight this pandemic, to keep their communities safe, to save lives on a daily basis. And so it is very difficult for them to accept the fact that the very people they're trying to protect are not taking their own welfare into account. And so nurses really want to be able to send the message to the public as well, that it's important that nurses are kept safe. We want their employers to keep them safe, so their places where they work and their communities, as well as our government leaders, to help make sure that that is the message, that we must keep our nurses and healthcare providers safe.
And just looking back at the last 2 years, you said in your statement that you believe in the safety and efficacy of vaccines. I want you to share with us how much that has improved with the availability of research and new research which has come with improvement, because obviously we moved from not knowing very much about the disease to having to develop scientific interventions to deal with it.
Absolutely. The science that has been developed in the last 2 years at record pace has been unbelievable. And when we think about where we were early in the pandemic, we had to understand where the virus was coming from, how quickly it could be spread, what were the conditions, how could it be controlled, and what did all of us need to do, certainly as healthcare providers, to make sure that our workers were being safe, and at the same time we were able to quickly address those who were becoming ill. And it was initially a slow process. And even as countries shared information across borders from place to place, it was difficult sometimes to know whether the conditions were the same. What we then were very fortunate to experience was this incredibly rapid development of a vaccine. And we know there have been other treatments and drugs that have come since that time. But it was the ability to vaccinate people that has been the most significant change. You know, we've seen over 150,000 nurses who died during the pandemic, many of them because of early exposure without protection, without the personal protective equipment, without knowing exactly how we needed to isolate patients. And so as we look at going across the 2 years, we see, again, the impact of vaccination, and knowing still, though, we have many workers who have not been able to get vaccinated. We're concerned, certainly in Africa, that only half of healthcare workers have had just 2 doses of vaccine. And so we continue to look at how the science is helping us understand the continued approach to keeping people safe, to reducing the spread. We are fortunate to see numbers beginning to be reduced in some places, but we still know that the pandemic is raging in others. So it is a global commitment to all of the activities that we know are important. Again, vaccination for everyone, making sure that we can educate those who have been hesitant to get vaccine access and equity, so that we are able to make sure that vaccines are getting into people and not that they're not lagging and waiting to be available, making sure that if individuals are sick, that they stay away from others, that we continue the preventive measures depending on the rate of spread and numbers of cases, so masking and distancing and hand washing, all of the things that are important in the presence of any kind of infectious disease like COVID-19.
So as we wrap up, I'd like to ask you, all of this new information, and of course these difficult circumstances that nurses have found themselves in, leading to a lot of innovation on many of the parts, given the obstacles that you've mentioned. How has it changed the future of work in the profession? And has it also increased what you say is the consistent consensus that nurses are amongst the most trusted profession in the world?
The workforce is fragile right now, and I think we know that in every country. Nurses have been on the front lines. They're tired. They have seen death in a magnitude that they've never seen before. So it's important for us to be able to also focus on their long-term mental health and well-being. At the same time, we know that they continue to show up, that they continue to have a very strong commitment to the people that they serve. And so it is important for us to continue to emphasize that we need to keep nurses and our entire healthcare workforce very safe. We know that some have taken a break. Some have said that they've endured so much that they need to step away and maybe work in a less intensive environment. And so we want to restore hope. We want to restore that desire to continue careers. At the same time, we are seeing a considerable increase in the interest of individuals to enter nursing, which is really encouraging. And that's part of what we believe is important for the future. Not only do we want to retain the nurses that we have, but we want to sustain and build a very big, healthy workforce, because we know without nurses, certainly in a situation like a pandemic, people will die. But without nurses, we can't really reach the goals that we have for universal health coverage and preventing premature deaths from non-communicable diseases. So the agenda of supporting nurses is a global agenda that is really important to the health of the world.
All right. Thank you so much for your time. Really appreciate it. International Council of Nurses President Dr. Pamela Cipriano just speaking to us about where nurses are at the moment in terms of their profession, calling on them to encourage vaccination, to all be vaccinated and also to be better protected, calling on them as well to help improve health systems around the country. We're going to take a break. When we return, Libya chooses a new prime minister as we focus on child rights in the education sector in South Africa.